Hello, hello, hello. Come on in. Come on in. Latrell, what's the topic for tonight?
Research.
Oh, what fun. I love research, actually. Totally love it.
Mm.
How are you?
I'm good. Good.
How are the boys?
They're good. Everybody's
That's right, the men.
yeah, the men. What group tonight?
Let's see. I've got a couple. Come on in, guys. Come on in. If you're new with me, remember your cameras do have to be open. That's the rule for a group with me. Let's see. Hello, guys. Come on in. Come on in. Come on in. Remember, you have to have your cameras open. I'll ask you twice. And if they're not open, then I will let you boop you, get rid of you from the group. Because you can go back and watch it later. If you don't want to participate, it's really okay. But if you're in my group, participation is required. And my camera was not on. I apologize for that. Okay. Can you hear me and see me okay? I see some people that I don't know. Oh my gosh. Tony, can you hear me and see me? Hello, Jocelyn. How are you? Can you hear me okay? Okay. Can you say something to make sure I can hear you?
Hey, Dr. Pam.
Very hello, 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 hello. Okay, so I see people that I don't know, which I always like. Welcome to group. Are you guys tutoring with one of my other coaches or just brand new to Dr. Pam?
Hi, Dr. Pam. I am tutoring with one of your other coaches.
Very good. Which one?
Elisa.
Very good, very good, very good. And do you have a test date?
October the 15th.
Very good. Are you a repeat offender or first time test taker?
I am a repeat offender.
We're Carl Rogers up in here. No judgment. No judgment. Okay. LC or LM?
LC.
Okay. And tell me a little bit about you. So tell me what happened prior to meeting our staff.
I was studying on my own. I thought it was working, but I retested 4 different times and I'm missing by 3 and 4.
Okay.
So,
okay.
I know I'm going down in the ethics part, but I can't figure out why, because I thought I was really strong in ethics. So where I am now. So that's why I brought a tutor in.
Okay. So I am sure that so first of all of my tutors have been trained by me. So what happens is they work with me, they go through our program, and they come back later and ask me if they can tutor for me. When I first started, I'm begging people to come play. I ran this Indeed ad, but now all of our tutors have come through us, and should teach the exact same way that I teach, but also bring in their own personality. That's like any other therapist, right? You got the basics, but you bring in who you are. And I love all of my staff. They wouldn't be on my staff, but I didn't think they were great. But I'm sure she's told you that it's a reading test.
Yes,
Okay.
I listened to you, so I told her I keep getting from you that this is a reading test. So that's what I got to think about and focus on.
So when I think about ethics, I think that most of my people are ethical. I think the issue is they don't understand the question, that you're missing something in the question. Okay. And the minute you pass this test, you'll be a better social worker, right?
I have the license. I don't know.
Girl, I try to make you a better social worker. I'm just trying to get you a sheet of paper.
Yes.
The only thing that makes you a better social worker is time and experience and having a really good supervisor. That's it. That's it. The sheet of paper has nothing to do with whether you're good or not. The sheet of paper is, do you know how to answer a test that was not written for you? Don't bring you in the test. Nobody cares what you think. No one cares what your agency does. We don't care. You have to know the rules of the game. And that's what we really want to teach you is the content and the rules. Because it's not fair if I don't know the rules of the game. And that's the problem is many times we just don't know the rules. Well, good luck. And we're going to talk about research shortly, but I'm also going to open it up for any other questions. I just want to kind of introduce and myself and find out my new people. So how are you, Miss Mel?
I'm wonderful, Dr. Pam. Thank you. How are you?
I am good. I am good. Miss Mel, where do you live?
I live in New York City.
Wow. So are you like downtown? Like, where are you?
I'm in Brooklyn.
Yeah, very cool. What do you do?
I'm a school social worker.
Girl, you make like 90,000. She didn't see, she probably more than that. I only know because I tutor school social workers all around the world.
This is my third year as a school social worker. So
okay,
you hit it pretty much on the nose.
Yeah. I wasn't trying to call you out. I just always say when people tell me that social workers don't make six figures, I say that's not true. That is just not true. So, and I'm not trying to, girl, make all you can, and you probably only work 186 days of the year, and more power to you. But I happen to know I've been doing this I've been in the field for 30 years, and I've been tutoring for quite a while, so I know about what you make. So, congrats. LM or LC?
LM, and I am also a repeat offender.
Okay. Did you open the AppGuard book a couple of times?
I have.
Okay, and do you still hate it?
I do. Do I think it's useful? Yes. Can I motivate myself to continue reading? That's the hardest part.
So who are you? Are you tutoring with one of my staff? And I'm sorry, I've got to just get my dog.
No, I am not tutoring with one of your staff.
Okay.
I was in a study group. I don't know if you remember Zoe.
Yes.
So Zoe referred me to you. I started watching your videos recently. And I logged on and I said, okay, let me start trying to attend some of your groups. I have not signed up for any tutoring yet. I'm not really sure if I intend to.
And that's certainly fine. That's not, we are not trying to take all your money. I just don't want you to keep taking the tests over and over again. Yes. I don't have enough money and I don't have enough self-esteem to keep doing it.
Yes.
So what we really do is let's teach you how to do it. But one of the things I'm going to do, and remind me at the end, I'm going to send you the bachelor's level of the AppGuard book. So when it comes to that, especially that chapter 1 of Erickson and Kohlberg and knowing those theories, so much easier reading at the bachelor's level.
Okay.
A lot of those community questions are also easier at the bachelor's level. Okay, somebody's got background noise. Is it
That's
you?
That's me. There was like a big loud truck going by.
Oh, that's what happens when you live in a big old city.
Well,
I live in Chattanooga. That's my street.
Yeah, so I actually have the front door and the back door open. So
me too. Yeah.
So that will make it a little easier.
The only thing they have to worry about when it gets dark is some coyotes that might come around.
Oh,
we don't got none of that where I live.
Yeah, no. No.
And I live in Chattanooga. It's not the biggest town, but where I live now kind of is newer development. So it used to be, like coyote territory. So we'll see deer, no big trucks, but yeah, you can't walk your dogs when it gets too dark. You might some animals out there. So it is very nice to meet you and good luck. And as we go today, and feel free to ask me questions. I'm going to open it up for questions in general. We're going to go over some general questions.
Okay.
And research, especially if you're only missing by 4 or 5, we're going to learn some of the basic research terms. Research are the easy ones. And I know it doesn't feel that way. However, they really are. You just memorize. And all of us are in this program because we went to school and we looked at the classes that had the least math. Right? Oh yeah, let me look at this. When this only got 1 math class. That's how we picked our major. Because we just don't think that way. We
Yeah.
don't think black and white. We think gray. And that's what makes it so hard for us, because these are just facts. And every part of our life, we're taught to question everything. We're social workers. We get paid to be nosy. We question everything. And while I tell you, again, it makes you a great social worker, it makes you a lousy test taker. Stay in the question, read the question. And when it comes to research, always just, what is it asking me? 3 times 3 will always be 9. That will never change. A single subject design will never change. Those are just facts. They're just facts. But most of us had some, especially at the grad school, we had somebody who probably wasn't a mental health professional, may not have barely spoke English. And I was crying at the door every day, going, please, I gotta get this class. So I think most of us struggled. And again, we just don't think that way. And if you'd asked me 10 years ago if I'd ever be teaching research and stats, I would have said, no way, no how. But getting my PhD, really doing the actual research and seeing what it looks like is really cool. Really cool. So I hope that you come to enjoy it and really see what role it plays in your life, because research really does play a role. And the Code of Ethics says we're all supposed to take part in our own research. If we don't do social work research, somebody else does, and they tell us how social workers should operate.
Yes.
And that's not okay. They're not our profession. Okay, nice to meet you. Hello, Jocelyn. How are you?
Hi, I'm good.
Jocelyn, have we met before?
Yeah, this is my second time doing group with you.
Okay, dokie. I knew that. I've been gone for 2 weeks.
I'm not too consistent, so
Okay,
maybe
I was
that's
going to
it.
say I was gone too. So, okay, Jocelyn. So tell me again about you. I probably asked you the same thing. LM or LC?
I'm a LM, a
Okay.
license in social work, and I am in Philadelphia, North Philly, and I'm in the city, very similar to Brooklyn. You'll hear loud music. Occasionally, today is a good Sunday evening. And I am doing school social work.
Very good. Very good. I've been a school social worker for a couple of times in my life. Those jobs are really hard to come by in most states. Is it the same in your area?
Yes, it is. But I've been a social worker for an amount of time, 11 to 12 years in the same community. And I find that is my strength, and that's how I was able to get the job. Yeah.
So I got a whole group full of school social workers. So my first job, I did my internship at so it was a clinical, actually. It was a school for emotionally disturbed children. So that was my internship. And when my supervisor called me and she said, I'm going to put you in this school, I cried. Like, I can't do that. I'm all like 24. I can't, I'm like, I can't do that. I can't. I saw like childhood schizophrenia. We were all trained to be restrained, to take down kids. I mean, I saw a little kid who thought he was a spider and he could climb the wall because he had been locked in a closet since birth. I saw such things, and it was probably the best training ground ever. And I was very blessed that while I was doing my internship I'm from South Florida, Miami, a third school opened up. And while I was graduating, that third school opened up. So I got a job in that school. So to get one of those jobs fresh out of college at that time was a really big deal. But seeing childhood schizophrenia, having a kid draw what he saw, those scary things that he saw, was wow. Yes, I learned a whole lot. I left that, did some private practice and some other things. And then when I had my second child, I went back to the school system and I got to work at a teen parent school. So I was the director of a teen parent program that was part of the public school. So I got to bring my children with me to daycare. I taught girls how to breastfeed because most of the girls had never seen anyone that looked like me breastfeed. And tucking your children in at night, things like that, that's seen on TV and had never seen it in the real world. And if you know anything about Miami, that's where I lived, a lot of our girls had really gotten off the boat a couple of days ago. All we required for you to get into school were shots. That's all you had to show. Sometimes they didn't have birth certificates. Sometimes we didn't know how old they were. And, people would send their children. We had a lot of Haitian, a lot of Dominicans, a lot of Cubans that literally would send their child, pay someone so she could have her baby in the United States. So we had like 4 different dialects of Spanish, but it was one of the best jobs I've ever had, ever. And for me, at least, teaching people that looked like me how to parent and how to it was okay to read to your baby, and it was okay to teach them, ABCs instead of the rap they were singing. So like their kids could sing the latest rap songs, but did other ABCs. I had kids as young as 12. One of the most rewarding jobs I've ever had. And I think for me, at least, living a legacy of just not seeing people of color, not necessarily Americans, just of color, learn how to parent. One of the things that I did, I did grant writing. And I used to use this as one of the best stories I've ever done. So I wrote this amazing grant that what I wanted is I wanted every child in my school to have a home library. I wanted every little kid to have every Dr. Seuss book possible in their house, because we had the mamas, and we put the mamas in daycare all on campus. We had the bus, the car seats, we'd pick them up. We had daycare on campus. We had nursing on campus. We had everything. And I really wanted to stop the generations of not being able to read. So this grant allowed my girls to go to Barnes and Noble and pick out books for their baby. The first time I got a call back later. Them girls ain't bought one book for their baby, and they stole half the shit. So I'd call Barnes and Noble back and say, okay, what are we gonna do? So they had to leave their backpacks at school, and they could only buy baby books. But again, I'm working with kids who are 15 and 16 who've never had the opportunity to get things for themselves. And if we talk about Erikson's stages, right? Erikson, their identity versus role confusion. So I'm between 13 and 21, and I don't know who I am. And my brain's not fully developed, and I'm supposed to be buying a book for my baby. I'd rather buy the latest fashion magazine. So a lot of that was just normal human development. We have little kids having babies, and we know that's a test question, that my brain doesn't fully develop until I'm 25. The reasoning skills, the rationalization skills. So when I'm going around to get funders to help us, help our program, and I've got girls who will get a gift certificate and they go get their nails done instead of buying formula. So, but that's human development. That's human development. They just don't know. So as we go on this test, do whatever, I always want you to remember, the goal is not to memorize it. The goal is to apply it in your everyday life. You do this every single day. And even when it comes to research and assessment, you do it every single day. Okay? Okie dokie. And I lost you somewhere. One second. Hello, Tony. How are you?
Hello, I'm doing good.
Tony, thank you for turning your camera on. And I'm very sorry if you weren't told before.
No, I didn't know. It's okay.
Yes, I apologize. So just because I've been a student and I know what happens when my camera's off, I'm doing 1,000 things and not paying attention. And I don't want you ever to do that. I want you to make you a priority and enjoy the time with us. You're in the room with the best and brightest people, not me, all these other amazing social workers. So we always just want to learn from them. So tell me about you.
I am in Houston, Texas. I'm studying for my LC. I'm working with Talisa.
Yes.
I work in medical social work, so I do care management.
You making the bucks too? Do you work for the hospital or do you work for?
Yeah, I work for a hospital. I work from home, so good pay. No
look at you! Look at you! Great job! Great job. So I talk about Houston a lot. I have a lot of clients that live in that area. Mm-hmm. And there's a theory called the stress inoculation theory. It's by Meckenbaum. Do you remember when you were little and you were taught stop, drop, and roll?
Yeah.
Okay, so that's Meckenbaum's theory. So we prepare ourselves for an emergency. So the inoculation is you give yourself a little bit of the shot, a little bit of the stress. So when it happens, you're prepared. So many of my Houstonians, I think that's the word, have lost power like 17 times this year. Whether it was hot or cold or wind blew or whatever, lost power.
Yeah.
So when I talk about that theory, it's Meckenbaum, stress inoculation. You know what's going to happen. Girl, buy a generator. Just go ahead and like put up and prepare for it. So that is it's called stress inoculation theory, and it's by Meckenbaum. It's in the APGAR book. You might not have seen it, but that's really what it says. All that means is if we prepare ourselves, give ourselves a little bit of the stress, the shot is inoculation, then when it happens, we're prepared. Okay, so stop, drop, and roll. When you were in elementary school, the fireman came to your house and told you what to do if you caught on fire.
Stop, drop, and roll.
Okay. You know, as an adult, that's pretty scary. I never thought about catching on fire. When I was a kid, I just knew the rules, stop, drop, and roll. But to catch on fire, it's like, oh, as an adult, I'm thinking, ooh, my weed might just burn. I mean, ooh, my face be all melted. Yeah. But that's Meckenbaum. And the way that I teach is not to get you to memorize, to teach you the verbiage that you already do, and then to understand how to answer the test questions that have nothing to do with what you do every day. Until you see your first name, last name in the sentence, we don't care what you do. And I'm not going to make you a better social worker. I'm only going to make you a better test taker. Okay. Rita, and I hate to bring it up, was a school social worker at some point also. So I think I think school social workers rule at this point in this group. So, and I'll tell you that when you get the school social work questions, don't bring your stuff into it. Do not.
I also did social work, school social work, before my current job. So I've had
I'm sorry.
experience.
So she left the social work to go to the VA, which is the next best job. So I'm just saying, I'm with the best and the brightest. Okay. The VA is the largest employer of master's level social workers. I graduated from college in 1989. Gosh, wow. 90. Well, my bachelor's in 89 and my master's in 91. And they were recruiting then, and they still recruit to this day. And you know that they prefer social workers. That's part of the NASW. We're very legally and legislation always fighting to keep other professions out. I tutor LPCs, I tutor LMFTs, I tutor lots of people, and they always most often regret not being an LCSW. We're the most coveted profession. We really are. Okay, so I'm going to teach research tonight, but before I get to that, ask me questions. Something you've seen on a practice test, something you've seen on TDC, on Savvy Social Work, something that you've seen. Let me help you understand it. I will tell you, hold on one second. Taking test questions is not studying. If you watch any of my videos, I'll tell you 1,000 times, taking test questions is not studying. Okay. I like the Pocket Prep app. I really do. I do. But I'll tell you, don't buy it until it's like 6 weeks or 4 weeks before your test. There's only so many questions, and you're going to see the questions over and over again. Stop wasting your money. Learn content. And unfortunately, the APGAR book is the best for content, but it's not the best for how to. Okay, there's both how we answer the questions and then content. Go ahead, Latrell. Sorry to cut you off.
No, I was just going to say my biggest struggle was trying to understand the types of validity. I'm having a problem with understanding it so I can be able to apply it, because I know there's face validity. I know there's predictive.
What's in this? What's in this?
Dog food.
What does it say?
I can't see it.
Okay, maybe it's not. It's
okay. Soft and chewy.
Yes, milk bone, the soft and chewy. That's face validity.
Okay.
That's all that means. When I look at that's what it says in there. That's it. That's it. Now, I've been using this all week. I've been teaching research like all week. So I really thought it's a really great thing. I could highlight some really good stuff in here because no one would ever touch it, because everybody thinks it's dog food. So I could highlight like some stuff in here nobody would ever know because of face validity. Okay. So that's really what it means. So we'll get into that, I promise you. And again, there's between like 6 to 8 questions. And if you're getting close, I don't want you to give those up because you were scared. Don't be scared. Don't be scared. We'll work on them. I promise you. Other questions, something you've seen that's not related to research. You just have a question. Go ahead.
It is actually related to research. I'm still struggling to like differentiate between reliability and validity.
Okay.
So
Can you hold on to that? Can you just hold on to that? I promise you I'll get to that. That's my lesson today. But I just want to see if there's other questions that are not related to research.
I have a question.
Yes.
So I'm sitting for my LCSW. I took the ASWB practice exam.
Don't ever buy it again. It's the same one. And you can ask the group, but most of my clients will say that is not near as hard as the actual real test.
I was going to say, I was going to ask, do you know if anyone says if it's easier than the actual exam? Because I found that test to be rather easy.
Anybody want to, I mean, I'll tell you my opinion, but anybody want to share?
Yeah, I'll share. It is absolutely easier than the test.
It's a lot easier.
I figured.
It's a lot easier. The LC, the biggest part of the LC is the verbiage is higher. You have to be a much better diagnostician and those social work interventions. So at my master's level, I can know Carl Rogers, just kind of person-centered, but at my clinical level, I need to be able to differentiate between Carl Rogers and Gestalt. Gestalt talks about the unfinished business, right? The empty chair, getting rid of the unfinished business. Gestalt means to be a whole person, and I have to be able to differentiate between the two of those at the clinical level. The assumption at that level is you are a clinical provider. Okay, so if I talk about feminist therapy, that's something that's on my LC many times. Feminist therapy was written in the 60s for women because at the time, you know, women's lib, we're all burning our bras, look at us, woo-hoo-hoo. But now it's really not about just women. It's about working with marginalized populations. So feminist therapist says, when I leave my house and as a woman of color, if I went to a feminist therapist and I said, I'm depressed, she would say to me, it's not inside of me. It's because I live in a predominantly white neighborhood. Because when I go to work, I teach college and I work with predominantly white men. So everything about me oppresses me. So it's not me, it's the political arena. So the goal of feminist therapy is then to, what the theory says is the personal is political. That what I'm feeling is not me, it's the environment that I live in. And it really did start for women, but it's not just for women now. It's about our LGBTQIA population, anyone who's marginalized. Remember a notebook paper, the teacher said, don't write in the margins, right? That's a little small part on the side. The majority population in this country is, it's actually white women. White women are 51%. When we look at the power, we look at white men. That's the majority population. Okay. And if we're studying a test, we're studying old white men, we're studying Freud, Carl Rogers, all those people, they didn't ever envision you. And let's face facts, if you come from the Eurocentric viewpoint, where Jane Addams was the mother of social work, Jane Addams didn't ever plan on working. She was a wealthy white woman, and this was her good thing to do. So remember, that's the hat you have to wear. As unfortunate as it is, you have to learn to play the game. Once you're in, once you have power, once you get in, you can change the rules. But when you're on the outside, you can't change the rules. And remember, who writes the test questions? It's you in about 10 years. Every so often, the ASWB puts out a call for test writers. And so you have to be licensed, you have to be in the field so long, and they pay you to write test questions. So remember, you know, there's no evil gods out to get you. But you're wearing the wrong hat if you bring your practice into what we do right now. That's the problem. You cannot bring what you do. And that's the hard part. I'll start with something simple. Can I take a gift? Miss Mel, can I take a gift?
It depends.
On?
If it's based on culture, and it has something to do with the person's culture.
So if they're Chinese, if they're German and they buy me a Mercedes, I can take it. So if they're made in Germany?
No, but if it's like handmade and it has meaning to it, you can.
And that is not quite what it says, but you're in the game.
Okay.
Yeah, there's no dollar amount. There's no dollar amount. There's no dollar amount. Okay. Your agency may have told you something, but the test doesn't say that. And when you see the test questions, they're not trying to trick you. If it says a client wants to give you $100 gift card to a restaurant, that's a no.
Right.
That's a no. That's a no. If I paint you a picture of your dog, keep it.
Yes.
If you know that I'm an aspiring artist, in a couple of years I may be famous, and I do a picture of your dog, that's going to be worth something. You can't take that. I always teach my young social workers, whenever it's diversity in food, you better suck it up. You know, us Americans, we ain't eating that. Them people, they eat dog, they eat cat, girl, you better bring a doggy bag, sit at the table, move your fork around, something. Don't you ever hurt a client. And you know, us as Americans, we ain't eating them people food. Please. It tastes like chicken. Get over it. Okay. So that's whenever it's diversity in food, that's always the right answer. What about going to a client's wedding? Is that okay?
I believe that it is in certain cases.
It just depends on the question, doesn't it?
Yes.
It depends. It really depends. And that's what they're looking for in the question. Those blank yes and blank no's it depends on what the question says. It's a reading test. It's a reading test. And I think that's where we get lost, is we're missing the details. And I'll say that for everybody, that's the hard part, is to take your time and go back to the question. Prove it to me. How do I know that's the right answer? What words in the question? Prove it to me. Okay. Ask me questions, things that you've seen this week, other places that you're not sure of.
I have a question actually.
Yes, Rita.
So can I read the question to you?
You can.
Okay. During a third visit to an agency, a client reveals to her social worker the name of her husband from whom she is estranged. The social worker recognizes the name as someone she previously dated. The social worker should inform the client, contact the husband, or find.
Whoa. Okay, stop at the question. Stop at the question first. Okay. Remember, we're going to spend more time in the question. So
yes,
I've seen a client. This is our third session.
yes,
Right. And I realized that my client's husband is someone I had a couple of night stands with. We did the nasty. Okay. He didn't say that. I just added it for the fun. Okay. So then what do I do? Before I look at any of the answers, guys, what do you think I should do?
So the thing is, like, I was not very convinced with the answer, that like the right answer, and
okay, hold on. But before you look at the answers, I always want you to think you know the answer before you look. And then you're going to try to find out the best based on what you believe the code of ethics says. Okay. So then what do you think the answer would be without looking at any of those four?
Don't tell the lady.
Oh, code of ethics. I think that's unethical. Do you know, by the way, I was boinging your husband. I'm just saying, I don't know that.
Would refer the client.
It's the third session. We have it. I can probably think we have it. Hold on.
Okay.
So it's a third session. So I could assume that maybe we haven't established rapport yet. So that might be okay to refer them. Okay. I like that answer. Go ahead. What did you, Miss Mel?
I feel like you disclose it and discuss the impact of what could come.
Do you know I boinged your husband?
We don't have to disclose that portion, but we can discuss that. We both know the same person.
Okay. Now let's go to my four answers, Rita. What are my four choices?
Inform the client, contact the husband, find the client a new therapist, or say nothing.
Okay, so let's rule out. I'm not going to say nothing. I can't ignore it.
And I will not contact the husband.
By the way, babe, you know, when we were boinging, now I got your wife. You were comparing notes. What does it leave me to?
Between inform the client and find the client a new therapist.
I don't like any of those choices. Where'd this question come from? I don't like any of those answers.
This one, trying to remember. I think from Leap.
Okay, that's not from Leap.
No.
Leap's questions are much better than that. And I always say, when you're doing questions, be careful of the source they come from. Leap's questions are really, really good. That one sounds like someone just wrote it yesterday.
Oh,
Okay, but I still have 4 choices. I still have 4 choices. So I'm between tell the husband or tell the client or make a referral.
yes.
Okay, so between those choices, what would you pick, guys? I
Refer
see
the client.
Jocelyn. Jocelyn, your lips are moving. Okay, Irma said refer the client. Jocelyn,
I said make a referral.
make a referral.
Make a referral.
They disclose it.
And someone said, and Miss Mel says disclose it. Okay, Rita, what's the correct answer according to that test?
Inform the client. That's the right answer. So, but
I don't know that I agree with that.
Okay.
I think I can make a referral without telling her.
Okay.
So what I would look for is I can't lie to her. I can't lie to her. But I don't know there's a reason to. So remember, everything we do is for the best of the client. I don't know there's a reason to tell her. I would probably just refer her out because it's the 3rd session. Now, if we've been seeing each other for 20 sessions and we had that therapeutic alliance and we were close, that's a different story. But it's only the 3rd session. So in this one, I see no reason to tell her at all.
So I literally had an identical question. It was worded a little differently. I'm going to look for it, and then I would like to share the one I had because I was in a study group this morning and we literally had a question very similar. So I'm going to find it and come back.
Okay, so let me tell you kind of the rules, okay? So first of all, I'm going to say, be careful of the questions that you study. Everybody's going to sell you questions, and I'm not a fan of that. Everybody's going to sell you questions, and that doesn't mean they're right, and it doesn't mean, yeah. So you should know the code of ethics no matter what the question says. I will tell you, there are TDC questions I disagree with. TDC is out of California, and their laws are not the same for everybody. I will tell you all day long, that's not right for the test. I teach social work. I do this for a living. I'll tell you, that's not right. However, in this particular question, in general, if I have a therapeutic alliance with the person, I cannot refer them. I seek supervision. I do. But when it goes to tell me it's only the 3rd session, that means we're probably not that tight yet. So in this one, I would probably just say to her, you know, I'm sorry, my schedule is really full, or I've got someone else that you can see, and let me refer you to somebody else. Okay. So in real life, I had a situation like that. And that's one of those ethical decisions. And you have to go through the ethical decision-making tree. I had a client who had just divorced his, a gay guy, had just divorced his husband. They were going through divorce. And he showed up in my office in crisis. And it turns out that the reason his husband got a divorce was because he was seeing my secretary, another man. Yes, exactly. And my biggest fear was if I keep seeing him, he's going to think that I knew. He's not going to trust me because he's going to think, oh, Dr. Pam knew, blah, blah, blah. And she got, no. So I'd only seen him once. And what I did is I saw him in crisis. And I just said to him, you know what? My schedule's really tight right now. Let me refer you to somebody else. Because if he had found out, he would have, and not just me, he would have not trusted therapists ever again. Right. So for me, that was unethical. So, but you might see questions about the ethical decision-making process. Do I seek supervision? Do I seek supervision in the ethical decision-making process? Do I need to seek supervision?
I don't think so.
You do not. Never. And if you ever have that question, you may have had an old professor or someone who was older teaching that you do not seek supervision anymore. That used to be the case, but not anymore. So the NASW ethical decision-making tree tells us what we do. Remember, the code of ethics doesn't cover everything. It's not possible. So if I have an ethical dilemma of what I'm supposed to do, these are the steps. I determine whether or not it's an ethical issue or a dilemma. It can't be my personal values. My personal values have no place in here, but it definitely needs to be something about ethics that's getting in the way. So I figure out what code of ethics it's violating. Okay, I look at the key values and principles. I put them in order. I rank the most important. I develop an action plan. And if that action plan works, we're good. However, I'm going to implement it and follow through to make sure that it worked. And if not, I have to go back to the drawing board. All of you have had ethical dilemmas. And most of you in the real world that work for an agency, you seek supervision. That's not the right answer for the test. The assumption is you are the very best social worker, and there's only 3 reasons to seek supervision. Do you know those 3 reasons? Go ahead, Ms. Mel.
One is countertransference.
Got it. Or the other 2?
I'm trying to think.
Anybody else? Supervisor has 3 roles. So so yes, Fashion said administration, countertransference. There's one more. Did you got the 3rd one, Fashion?
We just talked about it this week. I'm thinking.
Education, to teach me.
Yeah.
Education, to teach me. 3 roles. To teach me some things. When my stuff gets in the way, when I can't stand that client or I like that client too much, right? And then to teach me things. So if we're all learning now DBT in my office, then I really have to make sure that that's my job as the supervisor to teach my staff DBT. If the question says you're an intern or you new, you always seek supervision. But other than that, that's not an option. You are the very best social worker ever. You don't need anyone else to tell you what to do. If it's transference, if I'm in a session with a client and the client says, oh, Dr. Pam, I think you're very attractive. Do I seek supervision? I got some blank stares. Yes or no?
No, you don't. If he just you will set that boundary, and if they and once they continue to cross that boundary, then that conversation will look different.
Absolutely. I'm not running out of my office going, ah, not at all. To do. I'm the very best. So whenever you're choosing seek supervision on the test, make sure that that's the very best answer. You've read all 4 of those choices because that's very rarely the right answer. Okay. Other questions? Ask me questions.
I found a question.
Okay.
After
where's it from?
I don't want to tell you.
I just want to know if it's a reliable source. I own almost every piece of information out there. So.
PDC.
Okay.
After working with a client for 5 months, the social worker realizes that the client's husband works at the same company as the social worker's husband. What should the therapist do next?
So how is that different than her question?
It's different because it's not, I feel like it's not as much of a close connection because the therapist had a relationship with the other person, with the woman's
for 5
husband.
months. We've been tight though.
And right, and that
we're
was 3
tight.
weeks.
We've got therapeutic alliance.
Yes.
We are tight. So if we are tight, I'm going to say to you, babe, I just found out that our husbands work at the same place. How do you feel about that?
Yes.
That's a very different question than 3 weeks. You see the difference of how we can miss those? Because 5 months we're tight. That therapeutic alliance means I trust you and you trust me. So I can't just say, oh, by the way, bye. Okay. Do you see the difference and why we sometimes miss those? Because we take this blanket answer and it's a very different question. Everybody good with that? To see?
I have a question.
Uh-huh.
This is from the ASWB practice test.
Okay. Okay.
So it says, at the recommendation of the school counselor, a parent requests that a social worker assess her 10-year-old son because of persistent fighting in school. The parent says
he's 10. Okay. Go ahead.
The parent says the son is well disciplined at home and neighborhood. After obtaining a social history, what should the social worker do next?
Okay. I'm going to bet you said ask the kid.
How did you know?
Because I know that question. And I do this all day, every day. I tutor 100 people.
That's what I picked. That's what I would think.
Okay, well, I'm 10. Pam, were you fighting at school? Oh, not me. Him. Oh, me. You assessed the wrong thing. Assess the referral source. What did the teacher say?
Yeah, I see no.
Okay. Did you bring in some private stuff in there from your own job? How did we get there? Okay, read the whole question. I'm sorry. Let's read the whole question.
That was the whole
So
thing.
everybody knows that. Well, read the 4 answers. I just know the question.
All right. So A is obtain a release to talk with the school counselor. B, arrange to meet with the son. C, review school records on the son's social adjustment. And D, ask another family member about the son's behavior.
Okay, so let's go back to the question. So I'm a school social worker, and the school counselor calls me and says, "Hey, you know what? Little Bobby Johnny Jones is not acting. He's acting out." And I go to Mama, and Mama says, "Oh, not my angel. No way." And y'all school social workers, I know. No, not my baby, little baby, little Tyrone, little Alexandria. No way. Okay, wouldn't do that. So if I need to gather more information, I'm 10. If you ask me, what am I going to say? Wow. Oh, yeah, I did it. I bullied the heck out of that kid. That's what I did. You do need to assess first, but you assess the wrong source. Does that make sense? Go back to the guidance counselor. What did they see? It's his word against her word. I don't believe mom more than I believe teacher. That makes sense?
Yeah.
Okay. Got any more on there? I don't mind. I just want to make sure you.
I got it right. I got it right though, but I just wanted to talk about it. I'm going to try to remember. So basically the question was about your agency says that before you report abuse, you have to tell your supervisor.
Oh yeah. And the supervisor's not available.
The supervisor is not available. What do you do? I got it right because it doesn't show.
You better call that 911 hotline, 196 abuse. Okay. So the bottom line is I'm a mandated reporter.
Regardless.
I'm a mandated reporter. And if I don't report, and anybody school social workers get stuck with that? Gloria was school social worker too. Did anybody ever have a problem when a principal didn't want you to report? That happened to me a lot. The principal, and I worked in schools, especially when I was young, that I didn't stand up to him, and he wanted to know all the details before I reported. I got older. I'm like, that's not your business. But I really, when I was a first school social worker, I had principals who wanted to go to them first to report. No, I'm a mandated reporter. I'm going to lose my license if I don't report. And my supervisor may yell at me, but at the end of the day, I still got my license. I'm a mandated reporter. I don't have an option. Okay. And I'm sorry, the question, I know the question. So the question is, you're a school social worker, and you go ahead. You're a school social worker, and you're a social worker, and you're not supposed to report with until the supervisor gives you permission. And this question, the supervisor's not there. What do you do? And I think one of the choices is also like seek peer supervision. No, my peers know less than I do. I know the law. I know what I'm supposed to do. And I'm sorry that she's not there. And remember, the code of ethics says that your job comes before your clients come before your job. Now, personally, I don't adhere to that, but that's the TAS answer, right? So yeah, I'm going to report that no matter what.
What are the 4 answer choices?
I got it right. So they were very close. Like there was I can't remember. I think I got it right, so it doesn't show you. But there was only one that to me that was off, which was the one where you speak to like your coworker. But everything else kind of seemed right. Can't remember it though.
I think this is the test. This might be the master's level one. Does that look familiar? That might be the master's and not the LC, but I usually have both of them. I can look for it.
Yeah, these questions don't look familiar to me.
Look at that one. I like this one. You see this question?
Yes.
Linda, take that one for me.
Okay.
Have you seen this question before?
I have not.
Okay.
A child protective services agency social worker is working with a family who's referred because of child neglect. The parent has substance abuse and gambling problems. They frequently leave their children alone at night and fail to obtain routine medical care for them. The parents also keep the 10-year-old child home from school to watch the younger children. After completing a psychosocial assessment, what should the social worker do next?
So first, what we're going to do is spend the time in the question. Read the question, understand it before you look at any of the answers.
Okay. I'm a child protective services agency social worker working with a family due to child neglect. The parents have substance abuse and gambling problems. They frequently leave the children alone and fail to maintain routine care. The parents also keep the 10-year-old child from school to watch the younger children.
This actually looks familiar. I think this is the LCSW. And I remember getting this one wrong.
For completing psychosocial assessment, what should the social worker do next?
No. You just read it again. And in your own words, I need you to always spend more time in the question than the answers. When I say it's a reading test, they're dropping hints and clues all up in there. So tell me in your own words, paraphrase. That's how you got through college, right? Mm-hmm. Paraphrase and explain to me in your own words what's happening.
Okay. The parents have a substance and gambling problem, and they frequently leave the children at home alone at night, and they fail to provide routine medical care for them.
Okay. So do you realize they're already in CPS, Child Protective Services? They're already in right? Somebody's already called, somebody investigated, and they're already in CPS custody. And now I've got these problems. I've got alcohol, gambling. And them parents, they leave the kids home at night. They ain't taking them little babies to the doctor, and they make their 10-year-olds stay home from school to watch the kids. So CPS is involved. So the question is saying, I did the assessment, and now, so I'm always going to say to you, no matter what it says, I'm thinking, what will I do first? And remember, we get paid to be nosy. It's an intervention question if there's no assessment piece. Okay, so I'm assessing. So what would I do first? Now let's read all four.
Ensure that the parents receive substance abuse treatment. B, assess the availability and cost of services. C, refer the children for daycare services. D, help the family to identify services needed.
Okay, so the way that I teach is you're going to rule out what is not the answer, no way, no how.
So I'm going to rule out C.
Okay.
I want to rule out B.
Okay.
I want to select D for the answer.
That is the exact right answer. Now tell me why.
Because they are dealing with so many different things. So we got to figure out which ones to start with, which problems to, I guess, prioritize.
There's a word for that, partialization.
Partialization.
Okay, so prioritizing is putting in order, but partializing is breaking into bits. Partializing is how I eat an elephant, a bite at a time. So D is my correct answer. Okay, everybody see that? Here's what most people pick is A. Because somebody somewhere said, oh my God, if there's substance abuse involved, we don't do that. We got to do something with substance abuse. Never heard that one? That's what most people pick. Okay. And remember, in this question, substance abuse is no worse than gambling. It's no worse. An addiction is an addiction. Y'all all knew that? I'm just like singing to the choir.
I picked D, but I picked D for a different reason. And maybe I was overthinking it, but I picked D because I thought about safety. And so I thought about the kids
But they're
being at
already
home.
in CPS custody. They're already, so remember, they're already in CPS. So it's Child Protective Services. So they're not in danger. The question is, all these things are going on. Where do I start?
Okay.
Okay. So remember, it says, so that's the key in the question. They're already there. It's not like I need to report it. They're already there. Okay. I see too many confused looks to think that everybody got this right. Okay. So, Tony, you said you missed it prior. What did you pick the first time?
I can't remember why I didn't pick D, but I remember this question, but I got it wrong. I have to look at it to see what I picked. Because looking at it now, when she was talking, I picked D. Okay. But I know I did not pick A, so don't know.
Okay.
So maybe I
would have taken out B for sure, because there's not a question about the cost. We don't care about that. They're in Child Protective Services. The cost is not an issue. Okay. And some people will say pick out C because they say we don't refer on a first question. That's not true either. It just depends. It just depends. Okay. Irma, how'd you do on this one?
On this one, at first I thought, yeah, about the wrong one. A.
Okay. And again, so and again, just because I've been doing this forever, because usually somebody somewhere said to you in taking the test that we don't treat substance abuse and we've got to get rid of them. But what I want you to remember is it doesn't matter. Substance abuse and gambling are still addictions. They're both the same. They're both exactly the same.
Yeah, it's an addiction.
Okay. And again, I think it's the LCSW level. It may be the LM level. I don't know, but this is the practice test. So I say, please don't buy it again. Just don't, if you don't buy it.
I found it. I just pulled it up. It's the LCS level.
Yeah. I have the LM too, probably. So. Okay.
Okay.
So does that make sense? And again, I think I like the way this test is written, but I think on the LC, you'd have like the words would be a lot bigger and you'd be like, what the heck are they asking me? Okay. Other questions before I get to research? Anything you want to ask me? If you've not been with me before, remember what we teach is, I'm not a fan of the acronyms. We are not. I don't have enough room in my head. Yes, go ahead.
I was reviewing a video of yours for DSM, and you were defining egosyntonic and ego dystonic within personality disorder, but it just doesn't break down in my brain on like what is the definition. I didn't really understand.
Okay, so I'm going to put this in the chat box. So let me do this. Okay, so this is how we teach. We don't believe in the acronyms. I don't have enough room in my head. And what happens so many times is people get lost of where they're supposed to be in the acronym. Okay, so you learned this in school. This is your methods class. You had a whole 15-week semester, probably at undergrad and grad, if you have a BSW, of how we work. We assess first. I don't care what the question says. You're thinking, assess before intervene. I don't need all the acronyms. I don't need to eat pot cake, safari. I don't need any of those. Assess first. If I can't assess, two things are happening. One, there are feelings of the question. If I turn on the camera and I was boohoo bawling, you would not say, well, Dr. Pam, can you tell me about research? Hopefully you'd ask if I was okay. And safety trumps that. Assess. You're coming into the question thinking assess. Whether it says first, next, best, that's what I need to be thinking. We get paid to be nosy. Okay. And then I'm going to go backwards. Feelings and safety. Remember, we plan with the client, whether it's an individual, a family, a group, a community, it doesn't matter. We don't ever tell clients what to do. Right? Treatment planning is based on, we did the assessment piece. We say, hey, this is what I think is the problem. And together with the client, we come up with the treatment plan. It doesn't matter. Individual, couple, family, group, community. We operate the same way. That's what we do. So, okay, assess, 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 plan with the client. And I want you to remember that termination starts at the beginning. We are always trying to work our way out of the client's lives. When you set up SMART goals that are measurable, we'll be over in 12 weeks. We'll be done. Our goal is to teach people the skills to survive without us. Hopefully in your internship, hopefully that when you were learning, someone kept saying to you, remember, tell the client, we ain't gonna be in your life forever. Oh, we only got 4 sessions left, right? You're good, you're good. So termination starts at the beginning. We don't say the session before last, oh, by the way, we're done. We don't do that to clients. Okay. So that as we answer questions, whether it's content, whether it's whatever, this is what I want you to remember. This is how we answer questions. Okay. And again, if using the acronyms had worked for you, you wouldn't be in my group. Put that out there. Okay. Let it go. Just let it go because it ain't working for us. It's in the chat box. Download it. Okay. Now let's go back to your question. I'm sorry. I just want to get that in there before I went into place else. Who was asking me a question?
Oh, it was about egosyntonic and ego dystonic.
Yes. Okay. LM or LC?
LC.
Okay. So all of my personality disorders, and I've gone back and forth of how I teach them. Okay. So sometimes they're in the clusters, sometimes they're not. Okay. So I think you need to know the clusters. What's the only personality disorder with treatment?
I don't know.
Which one?
Not sure, I said.
Oh, come on. Some of my LCs. The only personality disorder that has a treatment. Marsha Linehan.
DBT?
DBT.
And what is she treated for?
Borderline.
Borderlines. The only
Yeah.
personality disorder that has a treatment.
Yep.
The problem is that personality disorders are ingrained. I have been that way since birth. I've always been that way. One second, let's share with you. Looking for my image. Okay. So on both exams, and I will say to you, the problem on the exam is it's very vague. It doesn't always give you the verbiage. You have to figure out between the lines what they're asking you. So DBT is Marsha Linehan, right? DBT, what are the 4 tenets? Anybody recall? I know y'all been treating some borderlines.
Is that where you're talking about the emotional regulations?
Mindfulness. Got it. Okay. So in general, personality disorders don't come for treatment because it's egosyntonic. They don't have a problem. Has anybody treated a narcissist? Oh my gosh, I think I'm so great. It's affecting anybody treated a narcissist? If they come to therapy, it's because and it's usually men for the test. It's so their wife will quit bitching, and for them to prove to the therapist how great they are. Okay, DBT, borderlines, Margaret Mailer, object relations theory, says the reason that you're borderline is because you did not have a connection with that one person when you were young. If you don't know Margaret Mailer, object relations theory, you need to know that. Okay. She said, if I don't connect with that one person, then I'm always going to grow up not trusting the world. And she said that a reactive attachment disorder. She said that conduct disorders, borderlines come from not having that internal. She's a neo-Freudian, which means it's an unconscious, but she didn't believe in the sex stuff because sex is Freud. So mindfulness, learning to enjoy the moment without judgment, just this moment, not what's going to happen tomorrow, what's going to happen later. Emotional regulation, our borderlines are up, down, left, right. But borderlines don't get that they control their emotions. They believe that the emotions control them. The stress tolerance, there's this innate being that we fight or flee. When we get distressed, if you've ever treated a borderline, when they come into your office and you begin to push their buttons, they stop coming. Because their MO is to fight or flee, and they just leave. They just leave. And interpersonal relationships, INTER, please remember that prefix. It always means with other people. Intercourse takes two people, INTER. And interdisciplinary meaning means there's other disciplines there. INTRA means we're all social workers, intradisciplinary. Intercourse takes two people. I don't care what kind of uglies you bump. I could care less. I don't care what you're bumping, but that's intercourse. Two people at least, right? The term intersex, INTER, sex, means I was born with both male and female parts. So knowing those prefixes will help you understand the test. Okay? So Marsha Linehan, the only personality disorder that has treatment. So let me go back then to my personality disorders. So when I say ego, we go back to Freud, right? My id is what?
What you want. What
Pleasure principle.
pleasure.
Right? Eat, sleep, and have sex. Freud says, if we don't do that, world won't go on. And my super ego does what? My little angel says what? Girl, if you touch that thing down there, what's going to happen? Don't be touching that, right? So innate, my id, Freud says, I'm born with the need to eat, sleep, and have sex. If we don't do those things, mankind will not go on, right? And remember, Freud is the first talk therapy. So everything we do, whether it's person-centered, whether it's narrative, whether it's all those things, it's based on Freud. Okay, so he's the father of talk therapy. He's always going to be on the test. Unconscious, insight, always Freud. Okay, so my id is my pleasure principle. My id says eat, sleep, and have sex. My super ego is my angel and says, Pam, don't you dare touch that. My id says, shh, I'm 59, almost 59, and I'm single. I can go out and give me some tonight. Ooh. My super ego is like, girl, you know you got to work tomorrow. You better get your ass in bed. Right? Because my id wants pleasure all the time. My id wants to have a pizza with double pepperoni and sausage tonight. And my super ego says, girl, did you look at your button? The ego is what balances the both of them. That's the reality principle. So my ego is who I am. So ego syntonic means it's in sync with my ego. I'm not going to come to therapy. All personality disorders are ego syntonic. I don't have a problem. And there's one DSM disorder that's ego syntonic. If you've been watching my videos, you should know that one. Which is that one? The one DSM diagnosis that's in sync with my ego?
Obsessive compulsive.
Nope. The personality disorder is in sync, but not the disorder. And there's a difference.
Okay.
My anorexics.
That's right.
Right? Anorexics never, they're fine. They weigh 4 pounds. They're not coming to therapy. They still think they're too fat. They have body dysmorphic disorder, right? They weigh 4 pounds and they're like, oh my gosh, I'm too fat. I can't come to therapy. So all personality disorders, and the only other DSM disorder is going to be then my anorexia. Okay. So ego syntonic means they were in sync with my ego. I'm not coming to therapy. So knowing the clusters, and Fashion Set and the last test, her last test, they were on clusters. So making sure you understand that. Cluster A is the odd and eccentric. Paranoid personality disorder, schizoid is schizotypal. The schizoids or schizotypals, do they hallucinate? Come on, be brave.
No, they're not.
Come on.
No, they're not hallucinating. They're
They
just different.
They're just
Yeah.
weird.
So yeah.
Absolutely. They're just weird. So schizoids avoid people. You all grew up with a person in your neighborhood that was schizoids. That was the boogeyman's house. And everybody said, just don't go to his house, stay away, because they're weird. They loved COVID. The grass is like this high, no one's ever coming around. This is your worksheet. You'll get this at the end. Okay. So my schizoids are avoiding. They avoid people. My schizotypals are, they'll talk to you, but you'll be so sorry they did. Go to Walmart at like 2 a.m. pre-COVID. You know, everybody's hanging out at Walmart and you'll get the weirdos. And they'll talk to you. They will definitely talk to you. They'll talk to you about, psst, always keep some toast in your pockets. Okay. The question will say odd or eccentric dress. Remember, for my LCs especially, the only two personality disorders that we diagnosed before 18 are conduct and borderline. So conduct is 6 to 16. And at 16, I can diagnose you with antisocial. Antisocials are very friendly. Asocial are people that aren't friendly. Antisocials are people that will kill you. That's the Jeffrey Dahmers. Those are the people that have no remorse. When you're a little kid, you're a conduct disorder. When you're setting the cat's, by school social workers, you've seen those kids. They set the cat's towel on fire. They steal the teacher's money. They steal everybody's lunch money, and they're not sorry. They're not sorry at all. There's no remorse. Those are conduct disorders. Little budding. In one of my videos, you'll see when my daughter was little, we were friends, and they were about 4. And the other 4-year-old daughter taught my daughter how to pinch the babies in the gym to make the babies cry. That's not normal. We didn't hang out with them after that. She was my gym buddy, but no, I can't be exposing my daughter to that. That's a budding conduct. We don't diagnose till 6, but little kids don't like to purposely hurt people, do they? Okay. So egosyntonic means I'm not coming for therapy. It's not a problem. Okay. Did that help? Ego dystonic means I don't like this. And when you talked about OCD, there's a difference between OCD and OCPD that a lot of people don't know. Anybody that's tutored with me before know the difference?
OCD, PD is the perfectionist, and OCD are the ones that have the thoughts,
Ding, ding, ding. Who's coming for therapy?
OCD.
OCD. They
OCPD,
don't like
they
it.
think they're perfect.
Absolutely. Absolutely. It's egosyntonic. All personality disorders are in sync with my ego. I don't have a problem. You do. If you get a borderline, she's going to come in. I don't understand why I can't keep a relationship. I don't understand. Just because last time my relationship, I thought he was cheating and I burned his clothes and I scratched his car. I don't understand why he doesn't love me. She don't think she has a problem. OCPD, personality disorders, in sync with who you are, because you've been that way since you were little, but we couldn't diagnose you until you were 18. OCD, your behavior gets worse. as your anxiety goes up, your compulsions and obsessions. Your obsessions are your thoughts, and your compulsions are the actions that relieve the thoughts. Okay. And all the people taking notes, I say, I've written inside this, I say, don't take notes because this is your video and I want you to watch it 17 times. If you're on my YouTube channel, I want you to watch it 17 times. I want to be in your head. I want you to go to work tomorrow and recognize the difference between a personality disorder and anything else. I want you to know it. I'm not teaching you to be a better social worker. I'm just teaching you what you do already. Okay, let's get down to some research terms. We ready? Yay, yay, yay. Okay. Okay. So I'm going to use, what I normally use is let me go here. I'm gonna do that. Let's start with some simple ones. What's a true experiment?
It has the control group and the comparison, the control group. It has to, is right?
Yes. Okay. So, okay. Maybe y'all ain't never been broke enough, but you know, you see those things, sign up for clinical trials, we'll pay you $500 for a clinical trial. And y'all ever, y'all ain't been poor social workers ever. Okay, whatever. Guess that's just me. So all the time you see on the news or on wherever, clinical trials. So what that means is they're looking for people to come in who are willing to be brave enough, or who maybe sometimes have a cancer that hasn't been treated, or doesn't have a diagnosis. What? So what happens many times, especially if I have like a cancer or something that doesn't have the doctors have exhausted all of their stuff. So I've still got this issue and I'm afraid, and I'm willing to sign up for a clinical trial. Dang, I don't clinical trials near me. I live in small town USA. Let's see here.
Is that when somebody will get the actual cure and somebody will get a placebo?
Absolutely, absolutely. So we use it in am I showing my screen? Do you see the breast cancer? Okay, so
Yes.
many times in the medical field, what happens is I've got cancer, I've got this whatever, and there's no proven treatment. So I'll sign up for a clinical trial. So what happens when I sign up, I call, I say, hey, I've got this issue. And there'll be 7,500 people that call up and they only need 100. So they will go through and randomly put me in the control group. The control group gets nothing, and the experimental group gets the drug. Double blind research. What does that mean? Nobody knows. I don't know if it's the real drug, and nor does the clinician. We don't know if it's the real drug or not. Okay. What happens many times is if the researcher knows which one is the real drug, then they may give you hints. They may be finding some things that aren't there. So in a true research, true experiment, half the people get the placebo or nothing, and the other half get the real drug. And at the end of the day, I'm seeing if there's a difference. True experiment. Okay. You cannot do that in a clinical setting. You can't have people coming to your office this week and thinking they're getting their regular CBT for depression, and you came up with some new stuff, and you can't do that. So in your agency, you have to do a quasi experiment. What does that term mean?
It's not randomly assigned.
Okay. So how do I do that? You're right. You're absolutely right. You're absolutely right. Now just tell me what that looks like. Come on, be brave. Come on.
Help me. Well, it's where the person, people know they're not randomly signed. Whoever, when you give them the treatment, it's people that are selected, but they're not randomly signed. It just
So
people
I know
Yeah.
that I agreed to sign up for this research.
Right.
Right. So that's it. So when I use a quasi-experimental, let me pull this up, guys.
And they get the control, and they get it's similar to, but it's just not randomly assigned. It's similar to true experimental, except it's not randomly assigned.
So I'm going to say that sometimes that happens, but also sometimes there's not even a comparison group. Okay. Sometimes there's just one group. One second. Let me just pull my...
So that would be like single subject.
Oh, nope, not even, nope. The answer, nope. Good answer though, but they're not related. They're totally separate, two separate things.
Okay.
Girl, when we met, you noticed stuff. Who are you? And where's the real trail? Okay, did you clone? honestly, you did not know this stuff. You did not.
And this, this is not
research would have scared you to death.
Yeah.
So for the people that don't know you, how did you get here?
Well, I've had a lot of trials. A lot of stuff has happened. A lot of stuff has happened. But how did I get to you? I was in a real bad situation where jobs on the line for one thing. But just tried everything. And Dr. Pam has been the one that has been able to make a breakthrough to get me to kind of really understand and break things down. So,
and I'm not trying to get brownie points. I just want to say to you that the people that are struggling and think I'll never do this, it's really, really, research is not that scary. It's not. It's really not. Come on, tell me it's not that scary.
It's not that scary.
It's not. It's just memorization and all the stuff that you thought when you were in school and how hard that research question test was. Most people I know don't even bother to study research. Oh, why can't I find my volume? Do something else. Sorry. I'm going to teach you through questions. That's the best way to do it. Okay, so a quasi means that's the only thing I can use in my agency. A quasi means that I did not randomly pick people, that I chose them for my test. I asked them, it's okay with you. Do you mind being in my group? Okay, so that's what that means. Those of you that have taken the test before, can you think of questions that you've seen that you want me to go over? And I'll do the single subject design. Can anybody else think of questions you've seen? Do you know independent and dependent variables? Have you seen those on the test?
I don't remember exactly what my research questions were, but they were not independent and dependent. I saw like it asked about like the A and B design.
Okay,
It also a single subject. One of them was also like if you have like a population of people, like what would that look like? Like what, I can't really remember all of it, but that's on mine. But it wasn't many at all, maybe 2 or 3.
Okay. I will say you probably had more than that, and you might not have realized that they were research. Okay. Program management, or asking about whether it's a summative or formative, is not research. Those are administrative questions, like how we run our agency. I'm closing out some windows so my computer doesn't.
Was that for the LC or the LM?
Both.
Oh, okay.
Both. So the code of ethics says that we're supposed to do research, that if we don't do our own research, someone's going to come in and tell us how social workers should operate. Okay.
So that
let me
much,
go.
Pam, for the quasi, it's two different groups, but we basically
No. In a quasi, I'm most often going to I'm going to ask you when you come in. I'm going to say to you, hey, I've got this new research. Would you be willing to try it?
Okay.
Okay. So no, we're not going to have two separate groups, and they're not going to be randomized. That's the one that's ethical to use in your group.
Okay.
Okay. So let's talk about single subject design, which is something most people see. It's an A-B or single subject design. Am I sharing my screen? Many of you use this all day, every day in your practice. Okay. So you can use it with an individual session, or you can use it in a group session. A client comes into you and they tell you they're depressed. You are going to take their baseline. And remember, with A-B design or single subject design or any kind of treatment plan, we're looking for measurable goals, things that we can measure. Okay. So then if a client says, I haven't showered in the last week, or behavioral goals, I can't get out of bed. In a single subject design, I'm going to take the baseline. So this is with a group of people. So this person is doing an FBA, a functional behavior analysis. An FBA is something that you would use in a classroom with kids who can't behave. And I'm looking at this one kid. I'm looking for the antecedent, what happened before. I'm looking for the behavior, and I'm looking at the consequences. What I know, if I can change the A or the C, I could also then change the behavior. Okay. So I go into the classroom and I'm looking at little Johnny, and I'm doing his baseline. And I'm saying, oh, look at little Johnny. Days 1, 2, 3, his behavior was off the chain. He had 6, 7 disruptions that one day those days that I observed him. I'm going to go to the teacher and say to the teacher, I'd like for you to use the intervention. I want your intervention to look like, I want you to give him positive praise. Whenever he's on task, I want you to give him praise. Okay. So then I come back later and I see if my intervention worked. So the B is the intervention. A is the baseline. B is the intervention. Did my intervention work? So if it worked, I see that his behavior goes down. Let's say it's a client that comes into you, like I said, with depression, and they're saying they're having suicidal thoughts 5 or 6 times a day. You take their baseline and you're tracking their suicidal ideations. You go home, the intervention, you tell them to go home and use some positive affirmations. If they come in the next time and they're still having suicidal behaviors, did my intervention work? It didn't work, did it? If the baseline, if it's still this high, it didn't work. So if my intervention didn't work on the first time, what am I going to do? And they're having suicidal thoughts. They're not getting any better. What do I do?
Change it.
Exactly. I'm going to put in another intervention. So an A-B is single subject, baseline, intervention. If it doesn't work, then I can repeat the same thing, an A-B, or I can try something else with a single person or with a group of people. You do it all the time. A client comes in, they give you their baseline. They're telling you this is the problem. You give them an intervention. And if they come back and it's not getting any better, do you do the same thing? You don't. You do not. You do not. You change the intervention. That's a single subject design. Okay. Let's go through a couple of things that, again, that you might see. Okay. You see am I sharing my screen? So correlation coefficient. I'm just going to talk in general because I just want you to understand the questions you might see. Quantitative research are numbers, the quantity. Qualitative research is how did you feel? When you go to any restaurant and they say, can you fill out this survey? They're asking about the quality. Did you enjoy what you got? Did you appreciate your service today? You call AT&T. They say, can you stay on the line for a 2-question survey? It's not the quantity. They're measuring the quality. Did you like what you got? So quantitative research, numbers, cause and effect. Correlation, or do these things happen to happen at the same time? It's election time. You'll see a lot of correlation. While Biden was in office, the crime rate went down. Does that mean Biden caused it? It just means these two things happen to happen at the same time. That's all that means. 1.0 or 100 is perfect correlation. Okay. The least I'll accept is 0.70. So 1.0, if I move the decimal point over, I can make it 100. And I can say 100 is perfect correlation. And the least that I'll accept, these two things that are correlated, the least acceptable one is 0.70. It doesn't matter if it's negative or positive. In correlation, as long as they go the same direction, okay? Gas prices go up, inflation goes up. Positive correlation. Gas prices go down, inflation goes down. Positive correlation. Gas prices go up, inflation goes down. Negative correlation. In group, the more I attend, the better the cohesiveness, right? So if cohesiveness goes up, what happens to attendance? It goes up as well. That's a positive correlation. Okay. So that's all it means when we're looking at these terms. Okay. So A, number one says the correlation coefficient that is not possible. Jocelyn, what's my answer on this one? Let's read all four and figure it out together. Jocelyn, you with me still?
Yeah, but I'm lost. What number am I
Do
on?
you see my screen number one? Or am I not sharing
Okay. Yes, I see it, but I see 1 and 2, so I wasn't sure.
Okay.
All right, number 1. A correlation coefficient that is not possible is.
So I said to you 1.0, whether negative or positive, is perfect correlation.
Uh-huh.
Which one of these is not possible?
Negative 0.60.
Nope, that's possible. It's not acceptable, but it's possible.
Oh.
Can I get better than 100?
Yes.
Really? You girl, I know you fine, but you can get better than perfect. If you a 10 on somebody's list, he might give you a 10.56, but for the test, you can't get better than perfect.
Okay.
So what's not possible?
The 1.26.
Thank you, because 1.0 is perfect.
Okay.
Okay.
And then the
0.
first one is 0.
That means they're not related at all. These two things are not related, not at all. So with correlation, what we know is, for example, the ACT and the SAT. Many colleges will take both of those or either one of those because they're 0.97 correlated. So if I do well on the ACT, the assumption is I'll do well on the SAT. If I suck on the ACT, don't even bother taking the SAT because you're going to suck on that one too, because these two items are related. It's not cause and effect, though. They just happen to be related. Okay. So right now in the real world, we're watching COVID numbers go up as the temperature went up. Have you read any relationship? Have you read any proof that says because it's so hot outside, our COVID numbers are up? Have you any research on that? But yet our COVID numbers go up when the temperature went up. That's a correlation. It didn't cause it, but it just happened to happen at the same time. Okay, that's correlation. 0 means these things are not correlated. Negative 60 is correlation. It's not acceptable. And 1.26 is not possible. With me still? Don't be scared because there are numbers. These are like 4 or 5 points that will get you over if you follow everything else, because math are the easy ones. You just memorize. Okay, So let's go try that again. Okay. So then, Miss Mel, take 15.
All right, I'm gonna do my best. I'm not sure if I 100% understand this yet, but
Okay.
let's
And
see.
we go learn it together, you and everybody
Okay.
else in this group.
The highest degree of correlation is shown by, I'm going to eliminate number.
1.0 is perfect. And I'm looking for the closest one, whether it's negative or positive, it doesn't
Okay,
matter
so
to me.
okay, wait, say that one more time.
1.0 minus or plus
Plus.
is the best I can get. It's 100. I'm perfect. Okay.
Mm-hmm.
So I'm looking for the number that's the closest to 1.0.
So I would say that would be 0.80.
Yes, you would. Would it matter if it was negative 0.80?
No.
It would not. It would not. It would not. It doesn't matter. It doesn't matter. Correlation is these two things happen to happen at the same time. It'll be very interesting in the next few weeks. If you watch the news, you will see all of these things. While Trump was in office, the borders, we had less people commit crimes. Does that mean that Trump caused it? Not at all. It just means these two things happen to happen. And that's what you're going to see in the news all the time with the elections. You're going to say back to the news camera, that don't mean he didn't know. It just means these two things happen to happen at the same time. That's all that means. Okay. Okay. So mean, median, and mode. The mean is what?
The average?
We learned that in 4th grade, right? The mean is you add all those numbers together. I got 6 numbers. I add them up. I divide by the 6 and I get the mean. The mode is the number that appears the most often.
Mm-hmm.
And what's the median?
The middle number.
In the middle.
Okay. And if I have a distribution, if I have numbers, I put them in order and then I look for the number in the exact middle. Okay. So 16 is yours, Tony.
The most frequent case is the A, well, not A, 1 mode, 2 median, 3 mean, 4 standard deviation, and it is 1 mode.
Absolutely. The mode is the number that appears the most often. Now, when I have a bell curve, the 68, 95, 99, right? That means, oh, it's fast when you see, you was lost on me there for a minute. Shaking your head like we went to a foreign language.
You said bell. Oh, okay. All right.
Yes, you do. You know the bell curve. You know the bell curve. Okay?
I feel like I remember more of elementary school than my master's program.
Well, because in your master's program, there's something that you knew this already. Okay. So remember, math has rules. Math has rules. 3 times 3 is 9, no matter what happens. It was 3 times 3 before 9 before you were born. When you have great grandchildren, you're up in heaven, whatever, it'll still be the rule. The bell curve is how we look at this. So 68% of the people, the majority of the population are going to be in the middle. We're just going to all be average. Average IQ is 100. Right? We look at the WAIS, that's the adult test. So if I'm 16 or older, I take the WAIS, that's adult IQ. The WISC, W-I-S-C, that's IQ for children 6 to 16. And the WIPSI, the W-P-P-S-I, is IQ for kids that are 3 to 5. My school social workers, many little kids take the WIPSI so they can get to school early, they can start earlier, or get in some big old fancy daycare. Okay, my kid used it because her birthday's in November and we were not waiting another year because she needed to start elementary school, so we took the WIPSI. It's an IQ test. Okay. Average IQ is 100, but it has a standard deviation of 15. So what that means is if I score between 85, and so this is the 100 in the middle, that's the average IQ. The standard deviation is going to be, they told me, I know the fact, it's between 15 and it's 15. So I'd be between 85 and 115. Average IQ is 100, but standard deviation means the amount of error that might be in the test. It might be bias. All those things happen. So if I score between an 85 and a 115, I'm still an average IQ. Okay. My school social workers especially, do you know at what point that you are too low to be in school?
Is it under 70?
It is. There we go. If you're under 70, the assumption is that you would not be okay in a school system. And we can talk about IEP and IDEA, about the Individuals with Disabilities Act, but if your IQ is below 70, we don't think that you can function in a public school. Okay? So an IQ between 85 and 115 is normal IQ. Okay? So whenever we see this, I always say everybody loves the pink. What that means is the majority of people, 2/3 of any population, are going to be average. This will be average. Okay. 68, 95, 99 is a rule. When I look at the bell curve or normal distribution, the mean, median, and mode are all the exact same number. Okay. And I know it's boring and I know it's math, but I promise you, if you miss by, or you're missing by 4 or 5, if you get these right, they'll get you over. And they're easy. You just memorize them. You cannot memorize anything else. Everything else you have to learn. This you just memorize. Bell curve, mean, median, and mode are all the same. I get a standard normal deviation, and the 6/8 is the middle, and everybody likes to be in the middle. 2/3 of my population is going to be in the middle. Okay. Still with me?
Dr. Pam, are you going to send us something on that to read up to retain the understanding of it?
I'm going to tell you that it's in the APGAR book, and I'll show you where it is, and I'll send you my test questions, but I'm not teaching you anything that you have not been exposed to. I'm not at all, but definitely. Okay. Okay. So let's keep going. I like this question. Number 3. Jocelyn, take this question for me.
Social work program evaluation research sometimes employs research methods that are thought to be unscientific and lacking in rigor. Many argue that the major reason for flaws in social work research methods can be found in the ethical requirements of a practice profession to provide.
Sorry, hold on. Let me switch you over. Oh, come on. There we go. Sorry.
Many argue that the major reason for flaws in social work research methods can be found in the ethical requirements of a practice profession to provide services to all. Select the statement below that best expresses a major ethical dilemma in social work research.
Okay, so stay in my question, because these are like foreign language to me. What the heck are they even asking me? Okay, what is it asking me? Stay in the question. Tell me in your own words.
So we're looking for unscientific research methods.
Where do you see that?
It says in the very first line, sometimes it employs research methods that are thought to be unscientific and lacking in rigor.
Okay.
Many argue that the major reason for flaws in social work research methods can be found in ethical requirements of a practice profession to provide services to all.
So let's go here. Are you familiar with when it talks about when I am doing research that I can be an observer, and a non-observer, participant? Do you know that terminology?
Sounds familiar.
Okay. So it's in the APGAR book. So what this is asking me is, so I'm real life. So one of the things I've had my students do is we've done a lot of research on tow truck drivers as first responders. So when I think of a tow truck driver, most people think these are nasty people that come to repo my car, right? That's what you think. What I know is I know that many times when there's a really bad accident, the tow truck driver is the first person on scene. The police can't get to all the smashed up cars because there's cars in the way. The tow truck driver has to get in there and really be able to kind of get the cars out of the way.
Mhm.
Tow truck drivers see the decapitated heads. They see the blood. They see all the things before the police can get there. So what we wanted to do is do research I wanted my students to learn to be observers. The problem with that research is if I show up and I'm just watching, I got a tow truck driver and he's seeing this dead body and he's pulling up, he's getting all of the body parts, the brain, all that good stuff. Can I just watch him and not participate?
Well, it sounds harmful.
Okay, so it's called participant observer, and I'll show what that is in the APGAR book. Okay, but the problem with that is in order to do research, I have to not be involved. I have to make sure that I'm objective. Research says I'm not involved. So the problem with social work research is that my ethics get in the way.
Mm-hmm.
Right? So that's what the question is asking me. Okay, so go back to that question. Let's read all four.
Social workers are poorly trained in research and cannot be relied upon to maintain ethical standards.
Don't bring yourself into that. That's not true.
Mm-hmm. A practice professional has ethical problems in actively denying, delaying, or withholding services to clients in need for research purposes. Clients do not understand the value of research and are unwilling to cooperate. It would be unethical to perform research without their agreeing on its importance. Clients are so diverse that it's difficult to create comparison or control groups.
Okay, so stay in my question. What do I know for sure that might be true?
Number 4.
Okay, so select all the statements that express a major ethical dilemma. Okay, so I'm taking 4 out. That is not true. It's not that they're so, I can definitely create a group based on what my clients look like. I can do that.
So what am I looking for? The question that indicates that there's a major ethical dilemma?
I am. But what I want to try to do is take out what it can't be. But if that's too confusing, then figure out what it can be. So I'm looking at select a statement that best expresses a major dilemma in social work. And this is talking about being an observer or a participant.
So we crossed out number 4 because that can't be a major dilemma.
Got it.
Okay. Number 3, we can cross them out.
Okay, that's exactly we know what we're doing.
Practice, professional. I could take out
Now between 1 and 2.
both of them are ethical dilemmas.
Okay, so tell me more.
Well, poorly trained social work, that's unethical.
As social workers are poorly trained in research and cannot be relied upon to rely upon to maintain ethical standards. Is that a personal thing? Is that where you're going with that?
Oh no, I was just thinking about like incompetence or social workers practicing without competence. But that's
Okay.
not what this sentence is
It
saying.
doesn't say that. We're
It says
specifically
it's
talking
like an
about
opinion.
research.
Right.
Okay.
So that's not it. We're gonna cross it out.
Okay. So what's my answer?
So then it's number 2.
Okay. I'm in the APGAR book. I'm going to show you. Let's go back where I can show you where we're talking about that. This is more of a code of ethics question than actual research question. Hear my dog. The dogs are snoring. Do you hear them?
No, do you hear mine?
No, my dogs are snoring like right beside me. So I'm like, okay, let me go back and so this has to do with participant and observer, and knowing that part of the thing with research, it's hard to just be an observer because I want to participate. So what makes research so hard as a social worker is learning to just kind of stay out of the way and just watch, because that's not what we're trained to do. We're trained to always just help. To come back because I don't want to waste your time. But there's a whole part of this book that talks about being an observer or being a participant. And it's most often ethical of what we do. Okay, so what this question is asking me is about, it's a code of ethics questions about being an observer or a participant. Okay, so part of the problem with doing research when you're a social worker is it's very hard just to observe. So these are the 4 choices, okay? You can be a complete observer. You can be an observer as a participant. You can be a participant as an observer, or you can be a complete participant. The problem is I'm trying to observe, and I see with the tow truck drivers, I see that they're upset. I see they're in pain. My code of ethics doesn't let me just sit back and do nothing. So that's one of the issues with social work research is if I'm researching that and I'm doing active research, then my code of ethics says I should do something different. Okay. It's in the APGAR book. I'll point it out to you. I'll try to put it in the checkbox. And I'll also, when I give you this, I just want you to understand that that's part of what we do is supposed to be a researcher. Okay. Do you see number 7? I'm on that screen. The source of illness? Yes. Fashion, that's yours.
Okay.
The source of illness among smokers can only be conclusively and unequivocally proven by. So the source of illness among smokers can only be conclusively and unequivocally proven by a descriptive study, a longitudinal study, an experimental study, and
Epidemiological research or evidence.
Uh,
So epidemiology is, so etiology is the cause of the problem. Epidemiology is how it spreads. Dr. Fauci was an epidemiologist. He looks at the spread of COVID. Etiology is the cause. When we're using the DSM and we're looking at schizophrenia, we don't know the cause. We don't, at ETI, we don't know what causes it. Okay, but the epidemiology is the spread. So 4 is not my answer, but just so you know that term, ETI, etiology is the cause, epidemiologically is how it's spread.
Okay, when I see this, I think of I know longitudinal. That's over periodic of time.
Absolutely.
So when I think about illness among smokers, those things I think of it happened over a course of time. So I would pick 2. And Dr.
You
Pam, I
would,
don't
yeah.
know what 1 or 3 are. So can we
A
talk about those?
descriptive study is, I'm going to tell you the exact things that I did in my research so you can do it yourself. I'm going to go by every single step so you can repeat my research if you need to. Okay. So validity is, does it measure what it's supposed to do? Is it valid? And then reliability is, can I do it over and over again? No, reliability is, can you prove it? Validity is accurate.
Okay.
Okay,
Okay, sorry.
When I get in my car, my instrument on my gas tank, that instrument I use that says my car is full, that better be valid. I want to run out of gas halfway through because it wasn't valid. So reliability is over and over again, but the most important thing is validity. A descriptive studies, I gave you the research to help you understand, to do exactly what I did. Okay. Longitudinal is what this is asking me. Okay. Irma, number 8.
A statistical method that is not used to measure reliability is?
And what is reliability?
If I can prove something?
Over and over again will I get the right answer, the same answer.
Yeah.
Remember,
I can be measuring.
Validity is the most important. Okay, but reliability is over and over again will I get the same thing. I will tell you that the test is reliable. If you keep missing by 3, 4, 5, 6 points, it's not the test, it's you. The test is reliable. It measures the same thing. But
It measures
validity,
what it's supposed to measure?
that's
Is that what you're talking?
validity. That's
Oh,
validity.
validity. Okay.
Validity is, does it measure what it's supposed to measure? Reliability is over and over again. I need a car that's reliable. I need to get in my car every day and think it's going to start.
Okay.
Okay. But validity is more important than reliability. Is it valid?
It's a measure what it's supposed to measure.
That is valid, but this is asking about reliability. Okay. A is split half correlation. What that means, if I take a test and I split it in half, will both halves give me the same answer? 3 is parallel forms. There are 17,000 versions of this test. You can take this test so many times, you will never, ever get the exact same test. It measures the same things, the same percentages, but you'll never get the exact same test. Their forms are parallel. If you're old as I am, when you were in school, that we had pencil and paper tests, and she would give, my teacher would give the row A, the first row, form A, and the second row, form B, so you couldn't cheat off each other. But it measured the same thing. And test retest says, if I take the test and I come back in 2 weeks and I've done nothing different, I come back in 30 days, I studied the exact same material again, I'm gonna get the exact same score. Okay, so the question says, a statistical measure that is not used to measure reliability is what? Read all four.
Okay, the statistical method that is used to measure reliability is split correlation. Number 3.
What's wrong with number 2?
Split half correlations.
What does number 2 say?
On number 2, concurrent correlation of validity.
Is validity and reliability the same thing?
No, they're different.
Absolutely. So 1, 3, and 4 measure reliability. But 2 says validity.
Oh, yeah.
Validity is it valid? Is it true? Does it work? Okay, I know none of you in this group, I know it's just me, but you might have bought some of them pregnancy tests back in the day, and you took the first one and it said you're pregnant and you didn't believe it, so you bought 17 more. And I know, just me. None of y'all ever had a pregnancy scare that you didn't want to have. I understand. I'm the only Black woman, only woman of color in this group that's ever had that issue. Okay, what I want is that test to be valid. It better be right. If I go to the Dollar Tree and I buy all these tests and 17 of the tests say I'm not pregnant, but the tests are expired, is it valid? Validity is the most important. Am I pregnant or not? I can buy 12 tests that are out of date and take all 12 tests and it says, no, you're not pregnant. But if they expire, they're not valid. And I want to have a baby anyway. I want you to not memorize it. I want you to use it in the real world. And I know I'm the only one that ever took a pregnancy test praying that I wasn't pregnant. I know none of y'all ever went there because I'm the only Black woman. I know. I understand. Make it personal. Don't try to memorize stuff. I want it to be valid. Okay, if you ever swipe left or swipe right, you want that man to be valid. I own 6 acres and I'm a millionaire, blah, blah, blah. He can tell me that stuff all day, but if he's lying to me, it's not valid. Validity is the most important thing. So this test question says reliability. So I know 2 is the best answer because they're not the same. Validity is, does it do what it's supposed to do? Okay. Number 11, Gloria.
Okay.
The director.
I have to move you guys so that I can see the form. How do I do that? Okay.
You see it?
Sorry, no, I don't see it. I see everyone, but I don't see the
Put in the chat box.
form.
You see it in the chat box?
Let me see. Yeah, okay.
Okay.
The director notifies the staff in January that they will be an ongoing study of the agency's process for receiving patients, staff courtesy in the reception area, and the frequency with which clients have to wait more than 10 minutes for their appointments. After 3 months, the director reports with satisfaction that there are few problems. Almost everyone is seen one time, and the staff is extremely courteous to clients. This may be explained by.
Stand my question. Tell me what's happening in the question.
So the director is letting everyone know, well, the staff, that come January, there's going to be a study about how the patient's processes with the staff and in regards to the staff courtesy while they're waiting, and the frequency with which the clients have to wait more than 10 minutes for their appointments. So after 3 months, the director reports that with satisfaction that there were few problems and that almost everyone was seen on time and that the staff was extremely courteous to the clients.
So I was told ahead of time, somebody's going to be watching you. They're going to be observing us to see how well we do. I knew that. And wow, when someone was watching me, we didn't have any problems. What's that called?
The Hawthorne effect.
Ding, ding, ding. That's the Hawthorne effect. We behave differently when someone is watching. Okay. That's usually on the test. And many times you have no idea what it means. And you don't even get that it's a research question, but that's what it means. We behave differently when someone is watching us. Okay. Okay. Ordinal, interval, nominal, and ratio. Have you ever seen those on the test? Never heard those terms?
I haven't seen those on the test, but you've talked about some of them before.
Okay.
In your previous group, I think they have to do with quanta, with the quantitative, the
absolutely.
nominal and ordinal.
Absolutely, absolutely. So these are called how we measure things. Okay. So with qualitative research, we look at nominal data. Nominal data talks about the categories. Okay. So I don't know. Nominal data just talks about men, women, whatever. It doesn't help me out. Ordinal data is order, first, second, third. Interval is time. And ratio is 5 out of 6, 6 out of 7. So you see that these two quantitative data have more to do with numbers, and qualitative data has to do with how we feel. Okay. Nominal or is qualitative. So qualitative is the quality. Okay, I'll put that in the chat box because there's probably questions there. And what happens is you have no idea and you just ignore them. They're usually on the test and you just don't know what they are and you just usually ignore them. That's what I find with most of my clients. Okay, I'm going to get to a couple of others and let you guys go. So but I want to get to a couple of others because they have a lot to do with sampling, and especially when it comes to my community questions. Okay, so what is stratified sampling? Okay, so what happens in community especially? If I do normal sampling, if I just do random sampling, and let me just go back here. If I do random sampling, if I go to the Walmart and I ask random people about their opinion, does that get sometimes my minority population? It does not. It does not. So if I do proportional sampling or stratified proportional, what I'm going to get are the people in my community. So what happens in a community, remember, those that have the power make the rules. So I don't want that. When I do research, I want to go out of my way to make sure that I get the entire community. So proportional and stratified proportional means that if we're trying to change some laws or some rules in my area, I am going to make sure that I sample people that match the community. So my community is 30% Black, 30% white, 30% Hispanic. I'm going to go out of my way to do proportional stratified. That means I'm getting the people that look like the community. And that's really important because if I don't do that, then I'm going to get majority rule, and we don't want majority rule. Let me show you this question. So when it comes to those research questions and sampling, it's because I want to get everybody that has say so, all of my stakeholders. Okay, see this question?
Dr. Pam, good question. Is that, are those two types, two different, or is it the same thing? The
stratified means I'm just getting categories: Black,
okay.
white, red, blue, poor, rich.
Okay.
Proportional stratified means that my research people match the community.
Got it. Thank you.
Okay. So if I live in my area, if I go out to Walmart right now and get some research, if I just do random sampling, I'm going to get majority white people. But if I want to make sure I get a representation of everybody, I'm going to look at the demographics of my community and make sure that my research matches the demographics of my community. So if I know it's 30% white, 30% Black, 30% whatever, I'm going to do proportional, stratified proportional to make sure I get all groups in. Okay.
Right.
Let's look at this one. A group of African-American families approaches a social worker who organizes a multi-ethnic, rapidly changing, conservative working class community. Let's just stay in that question. If you haven't been with me before, what is the question? What does that first line even say?
It's like locality, talking about the local.
Don't go there. Don't go there. You're thinking. I don't want you to interpret or reframe. I just want you to say. So I'm a social worker, right? And a group of African-American families came to me, and so they approached a social worker. My job is to organize multi-ethnic, rapidly rapidly changing conservative working class neighborhoods. When you think of conservative working class neighborhoods, what comes to mind?
White people.
Ding, ding, ding. And conservative, our Trump supporters are conservative. Okay.
So it looks like they're in a neighborhood that's changing or something.
It does. It's right. And I just read the first line. We're going to keep going. They're concerned about the discrimination and the rental of housing in the area. Okay. Rather than seeking legal remedies that are available, it's illegal not to rent to me because of my color or my sexuality. You cannot turn me away because I'm overweight or because I'm gay or because of my skin color. That's illegal. But they don't want to go there, do they? So rather than seeking legal remedies, the worker attempts to put together a broad-based representative community coalition to promote fair housing. If I do broad-based, what will my group look like?
A variety of people.
Diverse.
Well, let's face facts. What is the African American percentage in the United States overall? 13.4. So if I get broad-based, who's going to be there most often?
More white people.
Because that's not a bad thing. Those are just facts. That in America, the majority of people are white. If I do broad-based, that I'm going to say, hey, you all show up. Am I going to get the multi-ethnic people if it's just broad-based? And if they do, will they have the same voting power? Not at all. Not at all. Part of community is realizing that the majority of America is white. The majority has the power. And the goal of community is there's enough resources to go around. The people that have the goals don't want to share the resources. Okay. So in this question, understand broad-based means I said, hey, everybody show up to this meeting. And the majority of people that are going to show up are not going to be African American. Those are just stats in the United States. If you live in Atlanta is one of the darkest cities. It's 34% Black. That's still a third of the population. In the United States, it's 13%. So if I don't do proportional stratification, I'm going to get majority white. Do you understand that? And again, not just for the test of how community social work works. Okay. So then, in effort to build a coalition, it's likely the effort to coalition will be like what? Okay. So again, African Americans came to me. It's changing. It's changing. It's getting better. It's getting more diverse. But I know the majority of my stakeholders are going to be white because it says broad-based. Okay, let's read all four. A, succeed because fair housing is an issue which the entire community is concerned about. B, fail because elements of the community will not enthusiastically support fair housing. Policies, sorry, a little bit smaller. Okay. That will not enthusiastically support foul housing policies and may feel threatened by them. 3, succeed because the issue is a moral one and the social worker is committed to these values. 4, fail because the transaction and rental of housing property are private issues and nothing can be done to regulate private transactions. So let's start with the simple one. Will it fail or will it pass?
I say fail.
Sorry, that's a fail.
What do you think, Linda?
Think fail.
Why? What words in the questions? Tell me that.
Well, I'm thinking about what broad-based means
Mm-hmm.
in the working class neighborhood. And based on that, I'm thinking fail.
Okay. So fail is a good. So we're going to take out 1 and 3. Now between 2 and 4. Why will it fail? So when I get down to 2 and 4, and this is what it looks like, right? 2, because some elements of the community will not enthusiastically support housing policies and may feel threatened by that. Or 4, fail because the sale of rental housing is a private issue and nothing can be done to regulate private transactions. You said 2, Fashion. Why? What words in the question prove to me that 2 is better than 4?
Fail because some elements of the community will not enthuse. Okay. I picked 2 because it says some elements of the community will not enthusiastically support fair housing policies. And if you look back in the question, it's telling you that the majority of the people are the conservatives, like the conservative working class people. So that's not the population. So it seems like they would be threatened by other people coming in. That's what I got from that.
I would
I
agree
don't know
with
if I
that.
explained it the best.
Why is 4 not right? Anybody?
4 is not answering the
not true.
question.
So who said that? But other than Fashion? What'd you say about 4?
Oh, I think we both talked. I said that it's not, well, she said it's not answering the question. I said that's not true.
Okay. 4 is not true?
Well,
4 is not true. 4 is not true. That's not a private issue. It's against the law.
Yeah.
You cannot refuse to rent to me because of the color of my skin or because of my age or because of my gender. That is not a private issue. That's illegal.
Mm-hmm.
So this is what the community, while I don't want a broad-based, I want a population that is based on equal. I want there to be 2 Black people, 2 white people, 2 Hispanic people, 2 green people, 2 red people, 2 gay people. I don't care. But if we use broad-based sampling, if we don't purposely do strategic sampling, we're always going to lose because the majority is going to be white American. And as social workers, that is not what we believe. We believe that everybody has equal power. We believe in social justice. I want to show you how important research is in what you do all day, every day. And I know you all hate community and research, and you should not. Get over it. Okay, I got to wrap you up, guys. I'm not trying to scare you. I'm just trying to give you some extra points and understand the value of research and the value of community. Don't be scared. If you're doing grant writing, you have to have numbers. You have to prove that this is what works. You have to have numbers. Okay? You find tonight helpful or just stressful? Stressful. I get it. But I don't want you to give up the easy points. Don't give up the easy points. Don't give them up. It's not worth it. They're the easy ones. You took a class on this, by the way. I didn't make this stuff up. You have a master's degree in social work. If you don't have a BSW, I'll always say that you're at a disadvantage because the assumption is that your BSW, a lot of these things you already learned, and the MSW then is following up. And so I'll put the APGAR BSW in the chat box if you don't have it already, because that's a really great learn to go back and learn some of the basics of social work. Okay. Don't memorize. Don't memorize except for research. And don't just apply it to every day. Apply it to everyday life. Any questions? Okay. I'll try to get the video up tonight. Can't guarantee you that. I'll get this in the chat box with the answers on research. I'll give you some information on research. But don't be scared. Really don't. Just numbers. And it's worth it to invest in studying those few questions to help you really get to understand what it means. Okay, I can go?
Thank you.
Bye, guys. I'll see you next week.
Dr. Pam. Don't forget that you said you were going to send me the BS.
I'm going to put it in the chat box. So when you go back to our Pearl site, I'll put questions and I'll put the BSW guide in there for everybody.
Okay.
Okay.
Yep.
And honestly, it's easier read. And when it comes to content, it's the best way to understand some of the things that at the clinical and the master's level are just so complicated. You just think you have to know content. Okay.
All right. Thank you.
Thank you.
Bye, guys.
Thank you.
Bye. Thank you.